Emergencies in construction. IO's legislation usually requires that the constructor shall establish emergency response procedures for every construction site. Emergency preparedness helps to minimize the human suffering and economic losses that can result from emergencies. It should be understood that the size and complexity of construction works, as well as their access and location, have a bearing on the degree of planning necessary for emergencies. It is therefore strongly recommended that a member of staff on site assists in developing the emergency response plan. Planning shall begin before any work commences on the construction site. A good emergency response plan can be generic and, with some minor changes, can be easily adapted to specific sites and readily implemented. Development should include the following considerations: A. Hazard identification, assessment. B. Emergency resources. C. Communication systems. D. Administration of the plan. E. Emergency response procedure. F. Communication of the procedure. G. Debriefing and post-traumatic stress procedure. Between a 911 call and the arrival of paramedics and an ambulance. A crucial difference to an accident victim's recovery on a construction site can be made by the immediate on-site availability of trained employee responders with the right first aid equipment and supplies. In any emergency response procedure, the following consecutive steps are basic and essential: stay calm and assess the situation, take command and provide protection, aid and manage. Maintain contact and guide emergency services. A. Employer responsibilities. A person holding a valid first aid training certificate must be available to render aid to injured employees if there is not a physician, clinic or hospital in close proximity to the worksite. Where serious injuries may occur, close proximity is usually interpreted to be 3 or 4 minutes to the site. Serious injuries are interpreted as those likely to result in permanent injury or death if help is not available within a few minutes. Unless nearby emergency facilities and/or trained responders from local rescue services are available within that time. The employer must have enough trained responders always available to cover each job site during all work hours. The employer must provide a communication system for contacting emergency responders with appropriate transport equipment, and must post highly visible emergency telephone numbers if the job site is in a location where 911 service is not available. B. First aid supplies. First aid supplies must be easily accessible, stored in a required, weatherproof container with individual sealed packages for each item. First aid kits sent to job sites must be checked weekly to ensure that any items that have been used or expired are replaced. It often is best for trained responders to carry and take responsibility for restocking their own portable first aid kits. Metal kits are recommended where potential for damage to the kit is substantial. C. Beyond the minimum. It is highly recommended that first aid programs and KITs for construction sites go beyond the minimal requirements, particularly when there are multiple operations at one location. Large work sites are changing conditions. In addition, for large construction sites, it may be advisable to keep a bulk, restocking, supply of first aid materials in a cabinet at a central location such as a construction trailer at the job site. To assist in providing the right mix of first aid training, supplies and equipment, employers should use applicable low standards and prescriptions specified by relevant regulations. Consult with local fire, rescue department professionals. Consult with medical professionals at local emergency rooms and clinics. A hazard and risk assessment performed at regular intervals will help identify and update the specific needs of each worksite. and help employers determine which reasonably anticipated supplies should be made available as project and environmental conditions change. Beyond the basic construction first aid kit, common examples of first aid equipment and supplies for construction sites include bloodborne pathogen kits. Bloodborne pathogen kits should be available for employee responders reasonably expected to be exposed to profuse bleeding caused in many types of accidents or other potentially infectious materials. While rendering first aid, these kits should conform to applicable bloodborne pathogen regulations and contain personal protective equipment, gloves, gowns, face shields, masks and eye protection, as well as disposal supplies that can be used during treatment and cleanup, eye wash and shower stations. Where an employee's eyes or body may be exposed to corrosive materials or chemicals, the employer must provide suitable facilities for quick drenching or flushing of the eyes and body. Certain regulations may stipulate the rate of flow, e.g. at 0.4 GPM, and the duration of flow, e.g. 15 minutes, for portable stations. Portable bottles of eye wash may only be used in the quick treatment of less serious eye and skin irritations, cardiopulmonary resuscitation, CPR. CPR training is recommended for construction sites. A CPR kit with automated external defibrillator as well as micro-shields, filter shields and oxygen can be crucial to saving a life. Burn kits, universal supplies for general purpose of specialty kits, such as welders' burn kits, include scissors, medical gloves and gel-soaked dressings to help draw heat from a burn. Other supplies may include gel-soaked face masks, dry dressings to protect burned skin from contaminants, fire blankets to help extinguish flames or smoldering materials, and gels and sprays for pain relief of minor burns and protection from infection. Medicinals, providing over-the-counter OTC medications to ill employees can improve and sustain productivity, help boost morale and performance, and decrease accidents and absenteeism. While the employer may make OTC medications available in unit dosage, tamper-evident packaging that complies with respective labeling requirements, the employee requesting them assumes total risk and liability for their consumption.